Hi guys. We are so sorry about the delay. We had technical issues and welcome to IVSA Asian Online Symposium on Zoonosis and Public Health. So before we start, to all the participants here in the WebEx, please mute all your audio and turn off your video in order to not interrupt the welcoming speech. And we are starting shortly in 5 minutes. Thank you.
A warm good morning to Member Organization Director MOD of IVSA, Anina Sikeways, Chair of Standing Committee on Animal Welfare, Laure Chevalier, IVSA Regional Representative of Asia Region, Andre Farmeas, guest speakers, organizing committee members, and the participants. I am Asirvad Pokhrel, President of IVSA Nepal and Organizing Committee Coordinator of IVSA Online Asian Symposium 2020. It is a great pleasure to have this opportunity to say a few words before starting this symposium. At first, on the behalf of all the members of Organizing Committee, I would like to express our immense pleasure in welcoming you all and in hosting this online IVSA Asian Symposium on Zoonosis and Public Health. With the aim of not only sharing the knowledge of zoonosis and public health, but also increasing the coordination between member organizations, all member organizations of IVSA region came up with an idea of organizing online symposium on zoonosis and public health during this pandemic situation. The frequent interaction between human and animals due to increasing human population and increasing habitat destruction increases chance of transmission of zoonotic diseases, leading to threat to global health security and global economy. Thus, through this symposium, we aim to share knowledge and holistic understanding regarding zoonosis and public health for all vet students around the globe, focusing on the aspects of various viral, bacterial, and parasitic zoonotic diseases, their origin, types, and various diagnostic tools. The symposium lasts for 4 days, each day having 2 sessions and a session with 2 presentations, comprising a total of 16 presentations. We are overwhelmed with more than 1,800 registrations from 56 countries and hope that all the participants will participate till the last of presentation with the same level of curiosity and excitement. I hope with the end of this symposium, all the participants will acquire enough knowledge on different aspects of zoonosis and public health and thus can contribute to better public health as a whole. Finally, I would like to thank IVSA Global, IVSA Regional Representative of Asia Region, Andre, and all the member organizations of Asia for their contribution and continuous efforts in making this event a grand. My sincere gratitude goes to all the speakers for contributing as a resource person and for dispersing knowledge and experiences on the field of zoonosis and public health. I would also like to thank all the participants and appreciate your support and look forward to your contribution to the discussion. I would like to end my speech with welcoming you all again and expressing my sincere wishes for the success of symposium. I wish you all an enjoyable and most productive symposium. Thank you for your attention. Now, I would like to request the regional representative of IVSA for Asia region, Andre Firmansia, to deliver his welcoming speech on the behalf of IVSA Global. Thank you.
Okay, so I hope everyone can hear me. So good morning, everyone, especially morning in Asia. And thank you, Ashibat, for the opening speech. So I'm Andre Firmansa. I'm from Indonesia, currently holding the position for IVSA Regional Representative for Asia 2019 to 2020. I'm a final year student now in Universitas Gadjah Mada, Indonesia. So Zoonosis is a disease that can be transmitted from vertebrate animals to humans. And public health is a science and also an art for promoting health with various efforts from various disciplines. And 60% of human pathogens are zoonosis. 75% of emerging diseases are animal origins, and also 80% of bioterrorism is also come from animals. So it is a very urgent discussion amongst medical students and also amongst medical professionals. And IVSA has a mission to benefit humans through animal health. So we conducted many exchange programs to change ideas, knowledge, and also participants from all the 70 member organizations around the world to strengthen our bond and then to help other humans through animal health. And thank you again for all the organizing committee who are willingly to really spend their time in this hard time, pandemic time. So I've been working with some of the amazing and passionate OCs from 15 MOs, and I want you guys to remember this moment. So it's not over here. So I hope we can have another collaboration in the future. And also, I would like to appreciate Ashirbat who coordinate all of us. And I hope I can meet you all in the live person. And also, I would like to welcome all participants. We have other student organizations, especially medical students, and also all the 1,800 is participant, the registered participant that came from professionals, PhDs, masters, bachelors, and also professionals. And then lastly, don't forget to subscribe, like, and also turn on your notification so that you can follow all of the information of our live streaming. And I hope you can follow us until the end of the online seminar. Okay, thank you. That's all from me, and good luck and enjoy. Okay, thank you. Next one, we have a presentation from IVSA Global regarding IVSA and IVMSA joint statement on COVID-19. Laura, the online stage is yours.
Can you hear me properly?
Yes.
Okay, wait. Sorry, there seemed to be an issue. Okay, I think it works. Hello, I'm Laura. I'm the chair of the Standing Committee on Animal Welfare, and I'm here to present a policy paper that we have written in collaboration with the International Federation of Medical Students. So in response to COVID-19, the International Veterinary Students Association and the International Federation of Medical Students Association have come together to write a joint position statement. As the next generation of health professionals, we demand immediate change to prevent future pandemics. You might be thinking, but who are these people? So, IVSA and IFMSA represent together 1.4 million medical and veterinary students. This means that we are tomorrow's healthcare professionals, so it makes sense that we're concerned when it comes to zoonosis and pathogen transmissions. You might also be thinking, why this paper now? In the last years, there's been growing concern in the scientific community regarding epidemiology. Between climate change and ecosystem destruction and globalization, opportunities for pathogen transmission have multiplied tenfold. COVID-19 has proved their predictions right and has shown us just how bad a pandemic can be. It's crucial that we use this crisis as an opportunity to change course and avoid repeating history. Now, what exactly are we demanding? We want more preventive measures to be taken before the next outbreak, as well as an increased collaboration between countries and disciplines to improve biosecurity worldwide. Now, I'm going to repeat something Andre said and something I'm sure you'll hear in every introduction in this symposium. Up to 75% of all emerging infectious human diseases are of animal origin. This means that the pathogens have jumped the species barrier from the animal reservoir to the human population. This is made possible by three things. Interspecies interfaces are the places where the jump happens. So when you bring together lots of different animal species that aren't found together in the wild and in close proximity to human, you're increasing the chances for a pathogen to jump a species barrier somewhere. Disrespect for animal welfare, as well as stressful conditions for humans, are all factors that increase the stress of everyone involved, and we all know what stress does to our immune system. So that also increases the chances of a pathogen to jump the species barrier. And last but not least, low hygiene and therefore low biosecurity means that there's more chances for the pathogen to thrive in the environment, therefore giving it opportunities to survive a bit longer in the environment before infecting somebody else. These three conditions are met in cases of wildlife trade and trafficking, and also in cases of ecosystem destruction, be it directly through deforestation or indirectly through climate change. These situations are therefore at very high epidemiological risk. Despite this, we can see that there's insufficient regulation and enforcement regarding animal trade and consumption worldwide. There's also a severe lack of multidisciplinary collaboration and not enough emphasis put on the One Health approach. Now, what we'd like to do comes down to 4 points that should improve biosecurity worldwide. First, we need to regulate. We need more regulation on wildlife trade regarding the species involved, but also the conditions of trade and consumption to make sure that all along the line we conserve balanced ecosystems and we preserve biosecurity and hygiene. We need better enforcement of the legislation once it passes, and we need to make sure that enforcement stays constructive and doesn't feed into the escalation of violence we've been witnessing in some countries between law enforcers and poachers. Second, we need to support. Some communities rely on wildlife trade for subsistence, and we should provide them for alternatives. This means we need to make sure that conservation is worth more to them than poaching. Third, we need to educate. It's very important that people don't forget how important ecology is for disease prevention. Communities need to be made aware of what it's worth to have a diverse ecosystem, and researchers need to stop forgetting ecology when they're researching disease prevention. And we also need to make sure that One Health is included in the education of all concerned fields. Ecology, human medicine, and veterinary medicine should be putting the emphasis on One Health as it is the cornerstone for our future practice. And last but not least, we need to cooperate. There needs to be more international frameworks for interdisciplinary collaboration because the pathogen doesn't really care about borders or disciplines. All of this should improve biosecurity worldwide and should be put in place as soon as possible. In conclusion, the existing strategies that have been put in place so far are not enough and will not be enough to prevent another pandemic. This COVID-19 pandemic has had severe socioeconomic consequences, and we still have time to defuse the time bomb and tackle the root of the problem. This requires multidisciplinary international disease surveillance frameworks to be put in place, as well as more awareness to be put on ecology and its importance, and more research to be done into epidemiology and the epidemiological consequences of current practices. Thank you for your attention. Don't hesitate to go read the whole position statement. Either we'll send it to you by email, or you can find it on our websites, be it the IVSA or the IFMSA website. And if you've got any questions, I will be taking them now. I guess if there is no questions, Andre, you can also take over.
Yeah, so I told in the YouTube chat that we are now opening question for 5 minutes. Yeah, so we can just wait. So anyone has any question for the IVSA statement on COVID-19? You can send those questions through IVSA YouTube live chat or also WebEx chat. Okay, Laura, we have one question. So it's from Bimal. How IFMSA perceive the situation of COVID-19 a year down the line?
Well, I'm not IFMSA though. I'm IVSA, so I can't tell you for sure. But from what I've understood with the meetings that we've had with representatives from IFMSA, they're not necessarily very concerned with COVID technically 1 year down the line, but the concern is rather that the epidemiological status that we're in right now is so unstable that there will be other pathogens that emerge in the following year. So the concern is not so much on COVID directly, but on the conditions that have allowed COVID to happen, and these conditions haven't changed. Does that answer your question, Bimal?
Okay, there's another. Okay, thank you. Okay, that answered. Okay, there's another question from YouTube. So what are the possible acts countries can do to collaborate and ending this horrible pandemic other than through researches?
Well, there's several things, but to end this pandemic right now, there's definitely research, and there's also a necessity for countries to cooperate in terms of preventive measures put in place. So all countries should agree on measures that will prevent the spread of the pandemic and should apply these measures. And another thing is, if that happens, then it's possible for countries to help one another without it being unfair. So typically, to illustrate, in Europe, we've had cases where France and Italy have been completely overwhelmed with the number of cases that they've had. And Germany had a lot of reanimation spots free in their hospitals. And so they've opened up their hospitals for cases from France and Italy for a while, just to help out. And that works as long as everyone is trying to apply the same kind of preventive measures. As soon as one country doesn't apply preventive measures at all, it's a bit hard to then ask for help from the other countries. So I think what we need is to make sure that all the countries agree on the measures that need to be put in place, and then actually put them in place in practice, and then show solidarity. Does that answer the question?
Well, she hasn't said anything, so I hope that answers. We also have another question. So the question is, so in your opinion, what is the most important thing that we need to do for preventing the next outbreak?
In my opinion, the most important thing is make everyone aware of the fact that ecosystem destruction and increased contact between humans and wildlife is where emerging diseases tend to emerge. Because I feel like there's still a lot of people who haven't really grasped that, and this needs to be something that the whole human population is aware of, and we're very, very, very far from that. Now, I know that it's a little bit idealistic to present it that way, because obviously different communities and different cultures work in different ways. But there are ways to handle wildlife responsibly without taking as many risks as we're doing today. And I feel like too many people take it for granted that they can just pluck an animal out of the wild and bring it to a market, or go live in the forest or whatever. And that's everywhere around the world, when that's exactly what has caused very large pandemics in the past. And so I feel like it's important that everyone understands that they should stop doing that, because if they keep doing it, we're not getting out of this situation.
Okay, we still have 2 more minutes. There's I don't know whether this is a comment or a question. So there's this comment on YouTube. So how to take precautions for next outbreak?
Well, that depends what you mean by precautions. If by precautions you mean preventive measures, then what I've listed in what we're calling for in the position statement. So we need to regulate more, to have more support for communities that rely on animal trade, to educate and to collaborate. But if you mean once the next outbreak starts, what should we do? Then I would say we need to be quicker to contain the outbreak, because we've seen with the COVID-19 just how fast one small infection can be carried out.
Is due to run for 5 years, after which we will have another election. Currently, we have 182 member countries and territories, and in the Asian Pacific region, that's 32. So the regional and sub-regional representations are directly under the authority of the DG, and we collaborate closely within the region and between regions. So you'll see there that in the middle the yellow image that we have Tokyo is our regional office, and Bangkok is our sub-regional office in this region. And what we want to do is improve animal health and welfare by appropriate risk management. So this is our overarching goal. And a lot of what we do is setting standards and having health codes, manuals of diagnostic tests that can be used as guidance. And in particular, these are very useful for the World Trade Organization, as we provide some guidance for animal health and welfare on a global scale. So this is a summary of our 6th strategic plan. I won't go into all the details, but you notice in the middle that at our core we have risk management. We also are very interested in reinforcing trust through transparency and communication, and obviously supporting and strengthening veterinary services. You'll notice that this runs until this year, so actually we're now finalising the 7th strategic plan. But as I mentioned, our core is really at supporting and strengthening veterinary services. So I'll talk a little bit about how we do that. You'll be pleased to know that veterinary education is very important for us, and that ties in with veterinary services. As I mentioned, we have these health codes, for example, the terrestrial. Oh, I've just lost my share screen. Let me try to share again. Okay. Can you see that okay again?
It's okay.
Okay. So from the terrestrial animal health code, we use codes like that for things like this OIE tool for evaluation of performance of veterinary services. So this is PVS. And the PVS is very useful for our members to be able to assess what is going on, what level their services are at. So we start initially with an orientation, then an evaluation, which is quite in depth. We dispatch some experts to discuss in detail within each member what they're doing, what their veterinary services are able to provide. And then they look at the strengths and the gaps so that they can plan what needs to be done to improve certain services, and then targeting that support. So obviously trying to prioritize those. And this is a rotation. It goes through this pathway, so then they can be assessed again over time to see how they're progressing. Obviously, we want to support veterinary education because we know that having good veterinary education establishments in collaboration with veterinary associations and veterinary statutory bodies, this is how we produce really strong services for veterinary provision within a member. So to assist with veterinary education, we have these recommendations and guidelines. So the first one is the OIE Day 1 competencies. This is looking at what a graduate should have as a minimum when they graduate from a veterinary course. Then also some core curriculum guidelines. To assist with those, we have some twinning projects. And these are either between veterinary education establishments or also with veterinary statutory bodies to help improve systems within countries. And not forgetting that we also will assist veterinary paraprofessionals. So in many countries, these are very important workers in the veterinary services. And obviously, we can't forget the One Health concept. So although we're looking at animals, we want to make sure that we're also seeing how we manage risks at the animal-human ecosystems interface. And so that's where we have this agreement between the Directors General of the Food and Agriculture Organization, the OIE, and the World Health Organization. And a tripartite agreement, an MOU, was signed by those. And we then have 3 priorities. So at the global level, we're looking at zoonotic influenzas, antimicrobial resistance, and rabies. Actually, at a regional level, we also are interested in other zoonotic diseases that are maybe more important in the region. And one of the main texts that we've been able to produce together is this tripartite zoonosis guide. So this is a kind of how-to for zoonoses and working as a tripartite, and that's commonly called the TZG. And this is really how to take a multisectoral One Health approach to zoonotic diseases. So we're looking at not just zoonosis, but also other health threats at the human-animal environment interface. So I think it's very important that we don't forget the environment. I think it's already been mentioned that we need to think about both human health sector and animal health sector, but not forgetting that a lot of what we need to deal with is to do with our environment. And that can be used by countries themselves, including all sectors, and it includes best practices and also experience from different countries. So it's supposed to be a very practical and very useful guide for them. And it helps to build national capacities, and that's because there are guidance for things like multisectoral One Health coordination mechanisms and planning and preparedness, which are obviously very important in this current climate. Sharing information, investigation and response, joint risk assessment, risk communication, and obviously developing the workforce. And we know that not everywhere in the world has the same resources. So we want to optimize what we can do with the resources that we have. So improving efficiency and effectiveness. So we're going to aim to reduce costs, reducing societal losses, but improving health, that's both animal health and human health, and improving performance. And some activities that the OIE focuses on with this One Health approach are things that we've mentioned, so avian influenza, thinking about swine influenzas as well now, wildlife health, food safety, neglected zoonoses. So I won't mention them too much, but there are certainly many diseases that we need to help focus on as well. Rabies, AMR, and this multisectoral collaboration mechanism. So, for example, this is a multisectoral collaboration workshop. This is a biennial tripartite workshop. This one was in April last year, and that's looking at collaboration at the animal-human ecosystems interface. So it's involving multisectoral participants. I already mentioned the PVS pathway, and we also will work together, particularly with WHO, for the international health regulations. There are quite a lot of crossovers between PVS and IHR, and so we try to do bridging workshops where we will see where our members can work together and collaborate synergistically to help those. Food safety I mentioned, so again, we're talking about tripartite, but also other members as appropriate. So the World Food Programme also collaborates in preparing things like infographics for food safety. We have many materials for antimicrobial resistance, so I'll talk a little bit more about those later. The photo at the top left was for a workshop in Bhutan last year on antimicrobial use in animals. And this lower photo is just to show that everyone is now turning to virtual meetings, and this was a rabies meeting that we had planned to do as a physical meeting, but we now are turning to having virtual meetings. So a little bit about transboundary animal diseases, because we know that diseases don't follow borders. We know that they don't follow fence lines, so we can't say that one country will have a disease and the next one won't. There's a great risk that they could travel across borders, and also that we can get a risk from livestock to wildlife and vice versa. So we need to consider these transboundary diseases, or TADs. And one framework that is in place for that is the global framework for TADS, and that's a collaboration between the FAO and OIE. And they're working very hard to work on different diseases, including where we have zoonoses working with WHO. And contributing to achievement of the Sustainable Development Goals, or SDGs. So in particular, elimination of poverty, end of hunger and malnutrition, and also reducing inequality within and among countries. And looking at animal health programs, so for example, they've produced many publications and guidelines on eliminating PPR, just as an example. And awareness campaigns as well are very important, and you'll notice that we try to have these campaigns in different languages as appropriate to make sure that they're really useful for local people where it's important. But it's not just animal diseases. Obviously, we're considering zoonotic diseases, so looking at zoonotic tuberculosis, which is obviously a major public health threat, particularly in some countries. And I'll talk a little bit more about rabies, because that is obviously a very important disease, particularly in the Asian Pacific region. So for animal health programs, we're working together again with partners. So the United Against Rabies collaboration, which is the tripartite plus GARC, which is Global Alliance for Rabies Control, works together and produced this global strategic plan to end human deaths from dog-mediated rabies by 2030. So in many countries, the rabies reservoir is dogs. So that's the main goal. Unfortunately, rabies is endemic in many countries worldwide. As I said, particularly in this region, you'll see hotspots there, the kind of red and orange. So 95% of cases are in Asia and Africa. And unfortunately, most of these are young children. So that's why it's very important from a human health point of view. And there's a real economic burden. I think people don't like to talk about money, but unfortunately, this is very important for driving policy making and decision making. And you'll see that, that obviously the most important there is premature death. So huge economic losses due to that. But also costs in actually vaccinating, so post-exposure prophylaxis in people, where they are given a course of treatments after they've been bitten by a dog or other animal that is suspected to have rabies. But also looking at livestock losses. So this obviously can be very important at the community level. From the animal rabies point of view, again, we have animal rabies both in domestic animals and wildlife. And again, this is quite geographical. It depends very much on where we're talking about. As I said, in this region, it's mostly in dogs. So that's our main reservoir. And again, as you'll see here, we have some hotspots. So the red, again, is kind of ongoing disease outbreaks that we're really trying to focus. Now, we're lucky that some countries are free from rabies, but unfortunately, even those, there is a risk of incursion. So they need to have in place some certain procedures to reduce that risk. So I mentioned the 0 by 30 plan. The first objective is to reduce human rabies risk. So a lot of that is to do with awareness and education, but also then providing guidance and data on policies and decision making. And finally, the final objective is really to make sure that we have the resources to carry out those activities. As I say, we're currently focusing mostly on dog vaccination. Every year in September, we have World Rabies Day. And for the past 2 years, so 2018 and 2019, there have been webinars arranged by the regional tripartite, also with GARC, and we're also planning, actually my colleagues are in a meeting just now planning this year's webinar, so that will be going ahead again. So we're hoping to have more and more participants to try and raise awareness and try to give some useful scientific advice, but also helpful materials for people. Another tripartite activity that was carried out in Vietnam was a meeting, tripartite, so therefore multi-sectoral meeting, where those countries from the ASEAN region resolved to do various activities to improve rabies control in the region. So things like mass dog vaccination and preparedness plans. Integrated bite case management is very important. So this is where if someone is bitten, then they will identify the dog or other animal and monitor that, as well as treating the person as well, so that we can get a full view of the case. And then also information sharing. So it's very important to encourage information sharing between our members and also between sectors. Sometimes it's not always that easy to have a collaboration between animal health and human health sectors if they're in a different building, for example. Even within the same country, they may not always be having regular meetings. So we're really trying to encourage that. We unfortunately have had some recent reincursions of rabies, so in Sarawak in Malaysia, because of its close proximity to Brunei. Also, we sent an assessment team of experts to Brunei Darussalam. Thankfully, we have not seen cases yet in Brunei, but we obviously want to assess the risk and make some recommendations. So those are based on human and dog vaccination programs. We also found that there were some cat cases, so trying to include them in any advice about vaccination and responsible pet ownership. Public awareness. So if we have a country, for example, where there hasn't been any rabies, then people just aren't aware. They don't know how to reduce the risks to themselves. So we need to provide some education tools. Laboratory diagnosis is, of course, very important, and we're working hard to strengthen that capacity. So a few, again, other meetings that we've had. So the SARC region, so this is the South Asian region, and we had a meeting. Oh, I am just hearing feedback. Has someone got a mic on? Yeah, okay. All right, I'll just continue. Thank you. So in Nepal last year, we had a SARC region meeting, also as I've already mentioned, World Rabies Day, and this year the webinar series. So materials like this we will put onto our website. So again, those can be accessed, so either presentations or videos and reports. So if you're interested, then please check those out. We have, for animal health activities against rabies, we work quite closely with FAO. The OIE is obviously updating the manuals and codes to improve the guidance we have for diagnostic tests and for vaccinations. One thing that's very interesting topic is oral rabies vaccines that we're trying to develop. The mainstay now is still injectable vaccines, but there's a lot of research ongoing to oral rabies vaccination. Stray dog population is a little bit of a problematic issue, and we want to promote responsible dog ownership, so making sure that animals are vaccinated regularly, but also if they can be neutered so that we don't have lots of unwanted stray dogs. And this is quite small and quite a lot of text, but just listing lots of the activities and training that we've been able to do. So we've done laboratory training, both regionally and in country in many different countries. Also a rabies laboratory twinning project between the laboratory in Bengaluru in India and the reference laboratory in the US and the UK. And I'm very pleased to say that the laboratory in Bengaluru is now an OIE reference laboratory for rabies as well. So that's really great that we've got another regional expert laboratory. We've been assisting with mass vaccination and also risk assessment for countries that may have cross-border spread. And I already mentioned the webinars. The rabies vaccine bank is quite important because in some situations there are locally produced vaccines that aren't of very good quality. So what we have done is we put out for tender to have production of good quality vaccines, and then we will keep a bank. It's kind of a virtual bank, but we then will be able to meet with the laboratory or the producers to make sure that they can transfer the vaccines to where they're needed. And this means we're able to have a cost reduction. So unfortunately, we can't offer them all for free, but we have a cost reduction per vaccine unit, and we can make sure that it's quite easy for our members to get those. And we've provided over 20 million doses of vaccines to various countries. The FAO also does a lot of field level work, so particularly in teaching teams how to capture and vaccinate dogs. You can imagine that particularly if you have street dogs that are not used to being handled or caught, they're going to be quite difficult. So these teams will go around with nets, they'll be running, they'll be on scooters, and they do great work in vaccinating large numbers of dogs in a very short period of time. Also, I mentioned the integrated bite case management, so that's going to be collaborating between medical and veterinary centres. We'll have training of trainer workshops so that we don't just have to arrange one training programme that can be rolled out across the country. And communication, obviously, is important to increase awareness. For the human health activities, I guess the biggest recent news is that there have been updated guidelines on vaccination for people. And this is to make it more cost effective. So changing the route of administration of the vaccine so that we can use less vaccine is obviously a big cost saving for human health sectors. Also, the WHO has some laboratory guidelines on rabies as well, and trying to again collaborate between the different sectors, making sure that we work together for high level advocacy, particularly for investment into future and sustainable programs. So we need to make sure that we have political will and that we have national plans that are designed to deal with all these issues, that we can have outreach and education, that we're involving different stakeholders and make sure that everyone is on board. And our goal is 70% dog vaccination in at-risk populations. So this is obviously to get that herd immunity level so that we can reduce the risk to people. And making sure that we have access to vaccines, both human and animal, and also promoting the cost-effective vaccinations. I'm going to talk now very briefly about I know we're focusing on zoonoses, but actually AMR is going to be more and more of a problem as we have more diseases to deal with. So I'm just going to spend a few minutes talking about AMR. So I hope this video will play. If you just let me know that you can hear it okay.
Dr. Lesa, we are not listening the sound of the video.
I'm sorry, is it no, the sound isn't coming through?
No.
Oh, I'm so sorry. I'm so sorry. Shall I just continue to play and you can read the subtitles? You'd have to imagine the little jingle in the background. Is that okay?
Yeah, we can do that. Yeah.
Sorry. Okay, so I apologize that you couldn't hear the sound. I can share the link for the video so you can actually watch it on YouTube later or share it with others. But yeah, I'm sorry, with WebEx, I don't know how to make sure you get the sound. Okay, so I think most of you probably heard of the AMR, what the OIE and the tripartite organizations are doing for AMR. So we we collaborate with WHO to develop this global action plan on AMR, and then also to help develop a manual for national action plans so that we can make sure that countries are able to provide those outlines and sustain their actions and activities. The OIE has a strategy on antimicrobial resistance, and the focus on that is the prudent use of antimicrobials. And also, obviously, it's very important to monitor what we're doing and evaluate progress. So there's also guidelines, guidance on that. Okay, and we have a number of materials, so you can choose your favorite animal for the materials, and we also have these in several different languages as well. And these we have developed for different stakeholders. So, for example, we have some that are aimed at farmers, some that are aimed at policymakers, some at the general public, or at veterinarians. So if you are interested in any of these, then we have them on our website. Okay, so we come to SARS-CoV-19. So we know that this coronavirus, there are other coronaviruses which are zoonotic, such as SARS and MERS. So they were found coming from civet cats and camels. And and we know that SARS-CoV-2 causes COVID-19 in humans. The pandemic is driven by human-to-human transmission, and at this point, there's not really enough scientific evidence to identify the source of the virus or explain the original route of transmission to humans. And obviously, there's a lot of research ongoing into that to see what the original source and any potential reservoirs might be. And what role that animals may play. So whether it be as the original reservoir, that there was spillover, or whether it's kind of ongoing reservoirs. And the species susceptibility has been shown to vary quite a lot. So cats are very susceptible and can have clinical disease. But to date, only farmed mink have been shown to transmit the virus back to humans. You'll notice on the little image on the right-hand side there that I'm talking about veterinary laboratories. So obviously, most of the research on COVID-19 is done by human laboratories. But we know that veterinarians are really very capable scientists, very good technicians. So they are also able to help with the investigations and also with diagnostics in some countries. So what else is the OIE doing? Well, at the global level, we have an ad hoc group on COVID-19 at the human-animal interface. And we also have the OIE Wildlife Working Group, which is obviously very keen to investigate any wildlife that may be involved. And we have the Preparedness and Resilience Department based at OIE headquarters. And they're working in this case on wildlife and emerging disease. So I think this is maybe something that's very important to bring up. So we're obviously dealing with this current pandemic, but we need to have preparedness. So I think in many parts of the world, there really just wasn't preparedness for the scale of the pandemic. And so they're really struggling to catch up. And we know that we need to look at wildlife trade and make sure that there are proper guidelines to protect both our own health and animal health, as well as biodiversity. We do know that at this time, it is very important to maintain the work of veterinary professionals. We know that they can help by having good personal hygiene, obviously when you're dealing with animals and also with potentially infected people. We need to decide whether to test animals, looking at general hygiene when visiting markets and following OIE guidelines. And we also, because this is an emerging disease, any cases in animals should be reported to the OIE. So if there are any positive cases, then we also list those on our website. And so from these groups, we have some guidance documents, and the expert groups also publish their reports, so they're online. We have some of these social media cards, like the one you'll see on the right here, and they're all available if you want to share them or use them in presentations or on social media. That's fine. The OIE News in May was a special edition on COVID-19, so that has quite a lot of information about not just the OIE's efforts, but what we know about COVID-19. And there is also a Q&A page on the global website, which is regularly updated. We have a page on our regional website that focuses on some regional activities. So we're really, it's very important to stress that veterinary services are essential. So we know that we need to look after animal health and welfare, because we know that there's a risk if the carers become ill, that there may be problems. We know that if there are issues with transport, that might affect animal transport to market, for example. And then also veterinary public health risk management. So looking at meat inspection, for example, is very important, because it's vital that we're able to it's very important that we're able to take care of people's food supplies. So this is just one example of something from our region. So in Bhutan, the veterinarians are very experienced in epidemiology and lab testing and regulations, and they were able to work with the human health sector to support them in the COVID-19 response from the country. Okay, so looking then at some other regional activities, we have some webinars to update our focal points for communication. I mentioned already our regional web page. We also did a webinar on World Food Safety Day, and that we were looking at food safety in the current climate. So considering how things like closing restaurants will affect food deliveries, thinking about food safety, whether how safe it is to eat certain types of food, and there was really a lot of interest in the effect and the impact that COVID-19 has on that. So just in conclusion, I think I've just got a message to make sure that we have a little bit of time left. Just to say that the OIE activities are a global public good, and that we're really working for the global community to build a healthier future. So we're protecting animals, but we're preserving our future. We do have some social media sites if you're interested. And this is our web addresses at the bottom there. So thank you very much for your attention.
Thank you, Dr. Lesa, for your presentation. Participants, if you have any question, you can either write it in the comment chat box of the WebEx, or you can also comment on YouTube Live. So I'm picking some of the questions. The first question is from Binay CP, and it says, to work in a rabies diagnostic laboratory after getting pre-exposure vaccine, what should be the minimum rabies antibody titer?
Oh, you're asking me a human health question. I don't know, to be honest. So I think I would ask a medic. I apologize, but it's very good that you're getting pre-exposure vaccine, because that's certainly one thing that we encourage in areas. So, for example, in Sarawak in Malaysia, when they had the outbreak initially, they were having veterinary teams responding, and the veterinary teams themselves had not had pre-exposure vaccinations, and I think in a lot of systems, a lot of healthcare systems, the post-exposure prophylaxis is free of charge on their healthcare system, but not the pre-exposure. And so they had to work quite hard to make sure that the vets that were on the front line and their assistants were able to get that vaccination.
Thank you, Dr. Lesa. The next question is from Super Siri, and it says, as in the presentation, most of the details are in big point of view. Is it possible to go deep in a little details on what is actual responsibility and activities that veterinarians do? Also, do you have any suggestion for newly graduate vet student who want to participate in OIE, FAO, or even WSO?
Okay, so big picture versus little picture. Okay, so I guess you just need to look at the guidelines. So I've mentioned it very broadly today, but the guidelines do have a lot of details. One thing that I would suggest is that they are designed. They're as I mentioned, they're voted on by our delegates, and so they're designed to be agreed on by everyone. And so it may be that in certain countries, they're actually at a higher level, but we want these guidelines to be a minimum. So there will be probably differences in standards still between countries, but there is more detail in the guidelines, in the codes and the manuals. Yeah, I've not gone into a lot of detail, but it depends really on your interest. And the other question was about students becoming involved in the organizations. I think all the organizations will take interns. Usually it's a case of applying online and getting in touch with them and explaining. They usually have a form to complete as to why you're interested. So actually for myself, it was when I was doing my PhD that I did an internship. I did a 3-month internship in the Tokyo office. I had to do an internship and I wanted to do it with the OIE. Since then, we also, when we organize a meeting, we often have assistants or interns. So particularly when we go back to my alumni, we will ask if there are some interns, some students who wish to assist us during the workshops, for example. So some of it's a little bit tedious, helping us pack up folders of materials for workshop participants, but actually it's a really good experience to see what's involved in organizing a workshop and to actually be able to attend one. So if you're interested, then go online. I know that there are application forms available. Hope that helps.
Thank you, Dr. Besa. Another question is there any test that can diagnose rabies in humans before they show any symptoms?
There is not. To my knowledge, even in animals, so we do the antibody titer test. So as mentioned earlier, for after vaccination, so we can do that with dogs as well. So for example, if they need to travel between countries for their pet passport, then they can be tested. But the actual disease, our diagnosis is usually based on getting CNS tissue that's been damaged by the virus. So there are various laboratory diagnostic tests, but usually, for example, with animals, we will need to have a brain sample to be able to run the test. So for people as well, it's unfortunately to confirm is usually a post-mortem test. And for this is why it's actually very important to do this integrated bite case management, because if we can monitor whether a dog that was showing behavior signs and bit someone or scratched someone, if there can be monitored for a period of time, if they don't show any signs, then it's less likely that the person will have the disease. But obviously, if they show signs and they show clinical signs of rabies, and then if they're tested post-mortem, then that would confirm it. So that might affect the management of the person's case as well.
Khalisa asks, are there differences between local rabies vaccines and WHO vaccines? And does those differences cause danger to human?
So again, another human question. I would suspect so. Because there may be fewer safety checks. So the WHO as well as the OIE, so they have a vaccine bank for human rabies vaccines. And in that case, they will reach certain criteria. And although locally produced vaccines may be okay, we're not sure. So I would say that it will depend from country to country, but certainly the WHO will have those guidelines and those criteria for checking the vaccines that they organize.
The next question is, OIE has provided guidelines for compartmentalization to prevent the farm not to be affected if avian influenza epidemic happened nearby area. In India, many farms are going for it in last few years. What is the situation in other areas of the globe?
I don't know the specifics in each country, but certainly that's what we're recommending. Now, I guess one important point is that the WHO and their international health regulations are actually mandatory. So when countries join United Nations and or come under WHO, then they must adhere to those recommendations, those regulations. For the OIE, they are guidelines, so we don't actually enforce them, and we can't enforce them either. We are relying really on our delegates working within ministries. Usually, the delegate is usually the chief veterinary officer for the country, and so we're relying on them being able to advocate for the guidelines that we have. So I think in many countries, yes, they're following those guidelines for avian influenza and outbreaks, but that will depend very much on the national policy.
The next question is about the collaboration in any sector to increasing health. What OIE steps have done to prevent other pandemic, whereas we know transboundary disease is massive, particularly on developing countries.
I'm sorry, could you repeat that? That was quite long, or summarize for me.
In short, what OIE steps have done to prevent other pandemic, whereas we know transboundary disease is massive, particularly on developing countries?
Okay, so yes, as you say, transboundary animal diseases that we know of, we can have guidelines and frameworks in place to try to reduce their spread. So, for example, for FMD, foot and mouth disease, we have very strict guidelines for if a country, for example, wants to become FMD free. And that will affect the trade of their, for example, their beef products or whatever. With regards to diseases that we don't know of yet, so new diseases or re-emerging diseases, then this is where the preparedness comes in and the resilience. So it's really at this point we're trying to encourage countries to have a more forward thinking approach to it. So I think we saw with the COVID-19 in people, it's very difficult to suddenly have enough hospital space, enough hospital beds to deal with the cases that they're seeing. Whereas, you know, if we can think to have a little bit of flexibility within services, be that stockpiling of PPE equipment or thinking about investigating and doing surveillance for diseases. So one thing we're now looking into are guidelines for disease surveillance in wildlife in particular. So if we can try to pick up something that may become a pandemic or you know, something that can become a serious disease in people, if we can pick it up at the wildlife stage, then we might get it before it enters the human side or even into livestock. So for example, with classical swine fever and African swine fever, we're actually in a lot of areas we're concerned about those viruses circulating in wild boar populations. So you know, even if you have farms that are quite strictly controlled with their and they're not transporting animals or getting new animals in, if you've got this access to wild animals, they could be transmitting it to the livestock. So it's really looking, as I said, again at that interface, so between animals and humans and the ecosystems, that's including wildlife as well. So it's really trying to look at all of those, thinking about biosecurity and everything. So again, this depends very much on the country, how they're able to respond, but education for farmers, especially if we have lots of small farms, how can they improve the animal health and improve the biosecurity so that they're not going to be at such a high risk of these diseases coming in. So it's really trying to be prepared. So thinking about ways that, you know, diseases from the past have come in. So thinking about avian influenza that's coming with wildlife and wildfowl, waterfowl that are maybe not showing clinical signs, but if they're traveling over poultry farms and they're defecating, then we can get infection transmission. As I say, with the wild boar that are potentially coming in contact with livestock, with domestic pigs, then that's an issue. So looking at those interfaces quite closely to assess the risk.
Thank you, Dr. Lesa. Now, this may be our last question. It says, if you are familiar with the vaccine bank, would you mind elaborating it a bit, especially including students' organizations?
Okay, so the vaccine bank, I spoke specifically about the rabies vaccine bank, and this is for dog vaccination. So if it's for vaccinating people, then that's the OIE. They have their own vaccine bank for that. For the OIE dog rabies vaccine, the bank is accessed through ministries. So there's if you're interested in helping with mass dog vaccinations, and really it usually comes down from the ministries where they have some kind of plan, some schedule for mass dog vaccination campaign, and they will make a proposal and they will submit a form that we have to the OIE headquarters, and then they can access the bank. But it's not really something that's accessed from students. I presume this is maybe to do with running some vaccination campaign by the students, but that's not really what it's in place for.
Thank you, Dr. Lesa, for your beautiful presentation and for letting us some time so that we could know what OIE is doing. Thank you so much for being here.
Thank you so much for inviting me. Enjoy the rest of your conference, your symposium.
Okay, so this is the end of our first presentation, and let me provide you the code for the first presentation of first session. So all the participants listen very carefully. The code that will be given is required to fill the link that you will be sent in the email so that you can get the certificate. So the code is, all the letters are in small. So the code is B76AC9. Let me repeat again. B76AC9. We will also give the code in chat box, so you can also find the code in the chat box. So the code is, last time I'd like to say, B76AC9. So again, thanking Dr. Lesa for her presentation. I would like to invite Samantha to moderate the session and presentation of the Bangladesh. Samantha, the online platform is now yours.
Thank you, Ashibad. Hello, everyone. My name is Shimanta Dash, and I'm the president of IVSA Bangladesh, and I will be moderating the rest of the session. Before I introduce our next speaker, allow me to remind you the rules for the existing participants and for the new ones. Please always keep your audio and video turned off so that no disturbances happen while the presenter is presenting. After the presentation is over, there will be time for the Q&A, as you already know, for the question and answer session. During that session, please ask your questions through the chat box and via the comment section of YouTube. I'll be reading them out to our presenter, and he will try his best to answer you. If you're having any kind of disturbances while connecting to your audio or video, please let us know in the comment section. We'll try our best to help you out. And in the middle of the session, you will be presented a unique code, just like Ashibad presented right now for the second lecture. So make sure you keep your eye out for that and use it to get your e-certificate. Okay, let me present you the next speaker. He is a professor of microbiology, and he is currently in the position of professor in the Chattogram Veterinary and Animal Sciences University in Bangladesh. He is also the Dean of Faculty of Veterinary Medicine in the university. I will give the floor to him now to present the rest of the session. Please welcome Professor Dr. Abdul Ahad. Professor, the floor is yours.
In the name of Allah, the most beneficent and the most merciful. Assalamu alaikum. For your nice introduction about me. First, I'd like to express my gratitude to the organizer, International Veterinary Student Association Asian region, to select me as a speaker on the topic of viral zoonosis. It's a great honor and a privilege for me to deliver a lecture in a virtual workshop. Hopefully it is participated by the many faculties, students across the different countries of the Asia. And the next place. Next slide. Next slide. Now I'm giving the plan of talk. I shall discuss in my talk the virus structure, the definition of the viral zoonosis, and I shall show in the tabular form the symptoms of different viral diseases, and I shall give some brief description, some important viral diseases like Chikungunya virus, Congo hemorrhagic virus, Ebola, Influenza virus, MERS virus, Nipah virus, Rabies virus, West Nile virus, Zika, and SARS coronavirus finally. And the conclusion, I arrange this viral disease according to the alphabetically. Next. The definition of the virus. Virus is acellular entities consisting either DNA or RNA enclosed in a coat of protein, which is known as capsid, and it should produce only within the cell. Virus is the only organism, it contains either DNA or RNA, but it never both. Next. I'm showing a cartoon figure of the virus structure. The core structure of the virus is a viral genome, is either DNA or RNA. I already told it earlier. And it's covered by the capsid, and together it is known as nucleocapsid. After that, there is an electron-dense particle, which is known as viral tegument. But this structure is present only in case of the DNA virus, herpes virus. Other than the herpes virus, no virus contains this. Family herpes virus contains this viral tegument. And after that, there is a covering by lipid structures that is called envelope. It's a bilayer, and this is embedded by some spikes protein. The virus which contains the envelope, they're called an envelope virus. The virus which doesn't contain envelope, they're called naked virus. Generally, the naked virus is more stable than the envelope virus. And envelope virus are normally they dissolve in some alcohol and fat-like solvents. Next. Please. Okay. Zoonosis. Zoonosis is a Greek word, is a term. Zoon means animal, nose means disease. That means the disease which is transmitted from animal to man and human to animals, the vice versa. According to the literatures, some of the literatures found that human being can be infected by more than 1,400 diseases, and 61% is zoonotic. And among the infection disease, 75% is the zoonotic disease. And it has been seen in the one study in the 2005, it is published in the last 2 decades, and every year, almost we are seeing one disease has is popped up. Next. Transmission. Transmissions, zoonotic disease can be transmitted by the 2-way, direct or indirect. Direct is contact by the infected animals, by the bites or handling of the infected animals' tissues. Indirect can be generally by the arthropods. Arthropods, by this way, the virus can also be transmitted. Next. Now I am showing some of the viral disease which cause encephalitis in a tabular form, like the cholera tick fever virus, equine encephalitis, Japanese encephalitis, rabies, West Nile virus. These are all viral diseases. They cause encephalitis, and they are called the meningitis, encephalitis. Except the rabies virus, it is transmitted by the dog bite. Other than these, the viral diseases are transmitted by the different arthropods. Next, the next slide. Please show the next slide. Next slide. It's still in the encephalitis. Yeah, okay. And I'm sure just go to the previous slide, please. Encephalitis, then it is hemorrhagic fever. Let's go to the no, just previous, no. Please go to the previous. Please go to the previous slide. Okay. All right. Here you will see this is the disease where I am showing the encephalitis. Now, next slide. The hemorrhagic fever. Hemorrhagic fever. Please show the hemorrhage. Okay, this is the disease where the viral disease which causes hemorrhagic fever. The disease are lymphocytic choriomeningitis, Crimean Congo hemorrhagic fever, dengue virus, Ebola, and yellow fever. These are all the viral disease. It causes hemorrhage, and they are very fatal diseases. And these are also mainly by the arthropods. But the Ebola can be direct contact in the infected human beings. Please next. Next table is the shows the viral disease which shows the rashes and the arthralgia like the Chikungunya virus, and it is also transmitted by the mosquitoes. And the symptoms are the arthralgia and the hemorrhage. Next. Chikungunya virus. Chikungunya virus is also emerging disease. Rodents, bats, and the small mammals, they act as reservoirs, and there is no treatment, a cure for the diseases. Just only relieving the symptoms. And the Aedes mosquitoes, they can transmit this virus, and the Aedes mosquito habitation is the risk factor for the Chikungunya virus. The disease mostly affects in the Asia, Africa, and in the subcontinent. However, the major outbreak in the 2015 affects several countries in the regions of the America. Let's go. Now I'm showing the symptoms. You can see there are various symptoms. Chikungunya virus, the rash, the back pain, joint pain, vomiting, nausea, headache, chills, and fever. And Chikungunya virus, the people and the human, they have experienced, the people who suffer. It's a so serious pain. It is like that was somebody is just hitting with the hammer in their bones. The people feel that this way. Let's go to the next. Crimean Congo hemorrhagic fever virus is a viral disease, and the fatality can go up to 40%. The virus is primarily transmitted to people from the ticks and the livestock animals. Human to human transmission can occur, result from the close contact with the blood, secretions, organ, other body fluids. And chronic Congo hemorrhagic virus is endemic Africa, the Balkans, the Middle East, and Asia. There is no vaccine available for either people or animals yet. Here I'm showing the pictorial how you can see the small mammals and the bird, they are the reservoirs, and after that this virus can be transmitted by the different arthropods, and from arthropods it can be the virus is dropped then from the nymphs, then the adults, and these insects ticks, then they can transmit the virus to the human beings and or to the ungulates. And from human one to human, then it can also transmit it. Now, I'm showing a little bit detail influenza virus because it's the veterinary is the most important, and also here veterinarian and I want to discuss some little bit detail of this influenza virus, how it can be. Please, next. This influenza virus have the three types. They are grouped. Please, next slide, please. They have three. They are grouped into three influenza virus A, B, and C, and this typing based on the matrix protein. A can affect human beings, chickens, and mammals, and B and C affects only the human beings. Next, this influenza virus, we found there is lots of mutations. There are many possibly two reasons for this mutation. First, this is because this is an RNA virus. RNA virus is a lack of proofreading. When there is replications, as compared to the DNA virus, it undergoes much more mutation than the DNA virus. Besides this, influenza virus is a segmented virus. It contains 8 segments. There may be some reassortment, and then reassortment takes place within the segment, and that's the reasons there is so much mutation in case of influenza virus. Next, reservoir. Influenza virus are found in the 3 orders of the white-footed borders. That means the fits are they're connected. Like the orders is Encephalitis, Charidiformis, Grudiformis. These are the viruses. These are the avian hosts. They contain the virus. And this influenza virus, they contain 18 type of hemagglutinin and 11 subtypes of neuraminidase. That means if you do permutation and combination, that means almost 198 subtypes can be found in the influenza virus. Okay, next. Just I'm showing the figures. This is the Encephalitis, the ducts. It can act as a reservoir. Next. Just is the figure. Please go to the next. So this is the geese, then the Charidiformis, Encephalitis, okay, Grudiformis. Now, okay, come. This is I'm showing some of the birds which contain the viruses, and the list of some pandemics. Influenza virus H1N1. It was introduced in the 1908. It was an avian origin. H2N2. This is a reassortment of the avian and the human. H3N2. This is also a reassortment of the human and avian. H1N1. This is human origin. H1 and N1. It's a swine virus, and it is popular in the 2009. And it still is circulated. These are some origins of the pandemics and how it comes. Let's go to the next. History of influenza virus. Next. In the 20th century, influenza virus caused the 3 most prominent pandemic. One is called Spanish flu. It caused about 220 to 40 million deaths, and it's caused by H1N1. Asian flu 1957 it caused 1 million deaths. It's caused by the H2N2, and one in the year 1968 Hong Kong flu it caused 1 million deaths, and this is reassortant virus by the H1N1 and H3N2. And you can see how much death. It is more than the people died in the Second World War. Lessons from the past pandemics, and what are the lessons? This pandemic occurs unpredictable. Not always in India. Generally, we found that the virus survived in the low temperature, but it can be inactivated in the high temperature. but it is not always true. Great variations in mortality, severity of the illness, and pattern of the illness or may severely affected. Rapid surge in number of cases over a period of time, often measured in weeks, and it tends to occur in the waves. Subsequent waves may more or more. Key lesson is unpredictable. At any times, it can come up. Now I am showing the distributions of salic acid receptors preference. Please go to the next slide. And here, because the influenza virus, in case of avian, the receptor is alpha-2,3 salic acid receptors. It is found in the respiratory tract. And the human being, this receptor found in the lower region in the lungs. That's why influenza virus doesn't affect human being. Please go to the previous slide. Please go to the previous slide. Let's go to the previous slide. Okay, yeah, okay, thank you. And in human beings, generally it affects in human beings the people who are immunocompromised or the child generally affected, because alpha-2,3 salic acid is found in the lower regions, and the upper tract and the upper regions alpha-2,6 salic acid receptors. That's why influenza virus generally doesn't affect the human being. Is next. In pig generally is considered as a mixing vessels. That means it contains both alpha-2,3 and alpha-2,6 receptors. If there is a vicinity of the poultry and the human beings and the pig, there may be chance the new virus can be emerged, because for the poultry, they shed the avian influenza virus, and the mammals, they shed their mammalian virus, and both receptors found in the pig, and in the pig they can mix up, and the pop up new strains can be pop up from the pig. So it is not wise to keep all these three types of animals together, by in the poultry farm and the pig farm and also human habitats. Okay, let's go to the next. This is all about the influenza virus. Now come to the next, Ebola virus. Ebola virus disease is also known as Ebola hemorrhagic fever. This is a rare but is a very serious, a fatal disease. Transmission is wild animals to people and spreads human to population to human transmission. The fatality rate may be up to 50%, and the fatality may vary from 25 to 90% in the past outbreaks. And supportive treatment, the rehydration, symptomatic treatment improve the survival. There is no licensed treatment to neutralize the virus. Now I'm showing how the disease is transmitted. You can see this virus is a reservoir in the bats, and from the bats it can be transmitted before in some animals, and then wild animals, and it is thought that because there's some bush animals human consumes, and from that the human get it, this infections. And these are the wild animals. From these wild animals, it is believed that these animals, this virus is transmitted to the human being. Next disease is Middle East respiratory syndrome, MERS virus. Is a viral disease, is caused by novel coronavirus, SARS, Middle East respiratory coronavirus. The first identified in Saudi Arabia in 2012. As the coronavirus, its symptoms include fever, cough, shortness of the breath, pneumonia is the common, but not always. And also there may be some gastrointestinal symptoms like diarrhea, and also it has been reported. Let's go to the next. Approximately 35% of reported patients of the MERS coronavirus have died. The exact role of dromedaries, that means in the camel with the one hump is called dromedaries, is in transmission of the virus, and the roots is unknown. The virus doesn't seem to pass easily from person to person unless there is close contact. Such occurs when providing unprotected care to patient. Healthcare-associated outbreaks have occurred in several countries, the largest outbreaks in Saudi Arabia, United Arab Emirates, and the Republic of Korea. Now I'm showing how the transmission rate, the bats they carry, and from the bats, then a spillage into the dromedaries, from dromedaries, and within the camel, this virus can be transmitted, and from the camel for the human being, and from the human being, one human being to another. And you can see how the virus is transmitted. This goes to the next. In here, I just a little bit detail, and the bats, and from the bats it goes to the and also it may go to the civets or to the camels, and from the camels to the human beings, and from the human beings then it can goes to the other nosocomial infections. It can occur. Next virus is Nipah virus. Nipah, the name Nipah in fact is originated is a place in the Malaysia. It is first identified, that's why the name is Nipah virus. Nipah, and it's caused sometimes is a clean asymptomatic infection in the presentation, sometimes clinical presentation. It can cause acute respiratory encephalitis. And the fatality is about 40 to 70%. Transmission human to animals, from the bats to the pigs, and from human to human. Fruit bats of the Pteroptida family, they are the natural host of the Nipah virus. And they still don't have no treatment, just supportive treatment. Next, please. Just I'm showing how the pictorial, how this disease has been transmitted. You can see that in the bats, they are contaminating the date juices. Then at the time of they're taking the juice, and then they contaminate the date juice, and this date juice is sold to the different people, and people consume this contaminated date juice. And another way, the bats they eat the fruits, and sometimes the leftover fruits can be consumed by the pigs. By this way, the virus is transmitted to the pigs, and the pork sometimes it is exported, and it can be by this way it can be goes from another continent. This is the way that human beings can be infected from the Nipah virus. Next, please. Next virus is rabies. Let's go to the next. Rabies virus. Please go to the next slide. Pardon, please go to the next slide. The rabies virus. Rabies is an acute progressive viral encephalitis and myelitis that principally affects the carnivores and the bats. It can affect any mammals. And next slide. And here, let's go. Here I'm just showing the reservoir animals. What are the animals that carries the rabies virus? And I'm showing from the right and the top and to the left, the animal is raccoon virus. Then after the right is skunk, then the fox, and this way then the bats, the ferrets, the dogs, cats, mongoose, Arctic fox. These are the animals. They generally they carry they are the reservoir of the virus. But this reservoir is found in different continents, different countries. All the reservoirs are not found in the same country. Next, I'm telling how the viral disease is transmitted. Infected saliva is inoculated by the bite or scratch, and goes by the neurotransmission, it goes to the brain. They are very rare. Generally it doesn't happen. In very rare human-to-human case has been reported. It is found that one human being died from the rabies, and when his corneal was transplanted to another human being, then this way this human-to-human transmitted. There's a few cases reported, Aerosol is does generally because it's the envelope virus. Envelope is virus fragile, but there is no aerosol transmission. But it is found in some few cases in the caves where the bats live, and that means there is a shading of the high virus, and the air contain huge content of virus load, and at that time there may be some aerosol transmission. Let's go to the next. Bite management is the pillar of the reading of rabies. Washing the wound for 15 minutes with the laundry soap, and assessment of the wound will be done by the trained physician or the categorization, and after that post-exposure prophylaxis. Category of the wound. Wound can be classified in 3 ways. If it is just only licking, dog just licks, but there is intact skin, there is nothing damaged, so nothing should be done. Next, if there is any scratches or abrasions with the skin without bleeding, if just simply scratches, immediately the wound should be cleaned with the soap, and the rabies vaccine should be immediately taken. Rabies is such a disease, we cannot take any chance. If there is a scratch, any bleeding or bleeding without bleeding, if there is a scratch, it's just go for the rabies vaccination. But in case of bites, if there is bites, that means the penetration the skin is exposure. Of course, there is vaccination, and even then we have to provide rabies immunoglobulin around the site in case of the rabies virus. Next. This is all about the rabies. Now, the West Nile virus is a fatal neurological disease in human. However, approximately 80% people are infected, no symptom. And the host is intravenous transmission is by the Culex mosquitoes. It can cause severe disease and death in the horse. Vaccines are available for in the horse, but not still for the human being. Next. Next. Birds are the natural host for the West Nile virus. West Nile virus can cause neurological disease in the dead people, and is commonly found in Africa, Europe, Middle East, North America, and the West Africa. West Nile virus is maintained in natural cycle involving transmission between birds and the mosquitoes. Human, horses, and other animals and mammals can be infected. Now I'm showing the virus, West Nile virus transmission cycle. Let's go to the next. And the result of this is the result of the birds and the sparrows, and from the carries and the mosquitoes then carry the virus from the birds, and from mosquito it can go to the human beings, or human beings are accidental, and also it can be go to the horse by the biting. This is the way the virus can be transmitted. West Nile virus. Next is Zika virus. Next is Zika virus is a viral disease primarily by transmitted by the Aedes mosquito, which bite during the day. Symptoms are mild and clear. They might include the fever, rash, conjunctivitis, muscle and joint pain, headache. Symptom typically appears for the 2 to 7 days. Most people Zika virus don't develop any symptom. Next, Zika virus is next. This virus in pregnancy. Let's go to the next slide. This virus in case of pregnancy, it can cause congenital infection of the microcephaly, and it is called known as congenital Zika syndromes, and it may cause also the preterm birth and the miscarriage, and along with the neurocognitive complication is associated with other diseases like Guillain-Barré syndrome, neuropathy, and the myelitis. Let's go to the next slide. Here, just I'm showing how this viral disease is transmitted. The Zika virus infected the human beings, and after that, this is transmitted by the mosquito. And if it can affect the pregnant human being, and it can cause the congenital infections, and then also it may be transmitted by the blood transfusion. This virus can be transmitted by the blood transfusion. Let's go to the next slide. Now the Zika symptoms. You can see the figure, the fever, vomition, rash, headache, joint pain is like just a Chikungunya virus. There is sometimes it can be confused with the Zika virus, joint pain, and the conjunctivitis in case of Zika virus. And now, finally, some of you know, because this virus is pandemic, everybody is aware of that. So I have to tell something about this coronavirus infections. Let's go to the next. Novel coronavirus is a respiratory disease caused by coronavirus, like pneumonia-like syndrome. And this virus was first identified in Wuhan in China in the end of December 2019. Coronavirus is so named because it appears as like crown-like appearance. Crown means corona. This is the way, but this is the way the name came. Just for explanation, I'm just telling. Sometimes, if when the king is a ruler of the country and the king is retired, then if prince goes to the throne, and that day is also called coronation ceremony. That means corona means crown. Just I'm explaining that. And from that, the virus looks like a crown shape. That's why it's called coronavirus. International Committee of Taxonomy Virus is named as SARS coronavirus, severe acute respiratory 2 coronavirus. And this was named in the 11th of February in 2000. And after that, this coronavirus was characterized by the pandemic. It is characterized that it is a pandemic declared by the WHO. Next, please. The new name is disease COVID-19. Let's go to the next slide. COVID-19, CO means coronavirus, V is viral, and D for disease. This is the abbreviations of the COVID-19. Now I am showing the cartoon figure. I think you are all familiar with this this slide, how the coronavirus look like. Let's go to the next slide. This is envelope virus. There's an RNA virus as a positive sense virus. There's an envelope and is encoded by the spike protein, and it also contains hemagglutinin virus. Next. Coronavirus is a large family of RNA virus, mammals, single stranded RNA virus, positive cell envelope virus. It causes mild to moderate upper respiratory tract and affect the human beings, a common cold. In case of poultry, there's also one coronavirus, just to mention it, infectious bronchitis virus. It is very much endemic in case of poultry. It is not, coronavirus is not new. It is veterinary, it is very endemic. This infectious bronchitis virus is very similar to the virus, and it causes also the respiratory infections and is a high morbidity. But this coronavirus in case of poultry, this mortality is very low, but the infectious rate is very high, unless it is complicated by the other diseases. There are some other coronavirus, 7 coronaviruses, which is caused to human disease like 229E, OC43, and 63. These are also some coronavirus, but they cause mild form of diseases. Most of the case, all the coronavirus, they cause respiratory infections. Next slide. 3 of the coronavirus serious outcome in the SARS, severe acute respiratory syndrome, which emerged in 2002, and one I have already told, and the MERS, middle-aged respiratory syndromes, and just now the which is circulating coronavirus and the COVID-19, which emerged in the December 2019, and still is now, and we don't know when it will stop. The source of outbreak. Go to the next slide. In case of SARS virus, please show the next slide. And you can see SARS also is originated from the China, and the possible natural host is the horseshoe bats, and from that it comes to the spillage to the civets, from civets from the human being. And fatality rate is 10% in case of the SARS virus. And you can see in the next slide the transmission, how this virus is. This is the SARS coronavirus from the bat to civet and from civet to human being. And also this virus can be directly transmitted from bat to human. Cross to species, this virus, SARS coronavirus. Now next. It is the natural host is intermediate horseshoe bat and the pangolins. It is believed that the pangolins, they contain some virus which are very similar with the COVID-19, and it is assumed that this virus is transmitted from these wild animals, from pangolins, from the bats to pangolins and pangolins to human being. Next, please. Let's go to the next slide. The virus can spread between people who are in close contact with another in about 3 feet and through respiratory droplet produced when an infected person coughs or sneezes. It is believed that by the WHO there are people that means we are maintaining the social distance with the presuming these droplets can go maximum 3 feet. That's the way we are practicing. Next slide. The transmission rate. R0 is called the basic reproductive unit. So far it has been identified. The highest is the measles. The R0 is 12 to 18. In case of SARS, it was 2 to 4. And so far the calculations, in the early calculations, it is found that COVID-19, the R0 is 2 to 3. Next. Symptoms. Actually, we all know these things. Currently, symptoms are reported for the patient of the COVID-19, mild to respiratory illness like fever, cough, and the difficult breathing. Next slide. Now, just I'm trying to almost finishing. Let's go to the. Despite the research, in considerable research in eradicating the infectious disease, modern medicine failed to control the infection. It was people actually maybe that the scientists have some reluctance. Okay, we have control because we have antibiotics. Then, but you can choose the bacteria. We have vaccines, but it is now found that still we have not overcome the infectious disease. There are many diseases yet to come. Let's go to the next slide. Let's go to the next slide. The possible reasons. Possible reasons. Go to the next slide. Please go to the next slide. Possible reasons for that. Go to the next slide. The complex. There's a complex interactions between the environment, ecology, and social health care, human demographics. And there are various reasons. This is one of the reasons because the environment and this way. The adaptations. RNA is a very clever virus. And within the passage of time, they also adapted within the environment. And it's very common is the RNA virus. Is a mutation is highly mutation rate is very high in case of RNA virus. And also there's human migration. People, as compared to the other decades, people now move very frequent from one country to another. This is where the disease is also transmitted. And the change in the land and the user pattern. There we call the deforestations. and the forest has been damaged, and the human beings live over there. By this way, the animals are disturbed, their flora is disturbed, and this way there is spillage of the animal virus to the human being. Let's go to the next slide. And the mining, because of the mining, there is also caused disturbance of the ecosystem. That means, whatever the reasons, if there is everything in this world everything is balanced, in the forest, animals, environments. But if we damage, we don't understand the immediate result. But we can see for after several years, then we can see what we have damaged. These are all due to this. And the coastal land degradation, wetland modification, habitat deforestation, and the human intervention in the wildlife, like hiking, camping, and this animal wildlife is dispersed, and wildlife, and these are all these viruses. They are in fact the virus of the wildlife. They were the wild animals, but because of now we damage the ecosystem, and this is the reason the spillage of this animal virus to the human being. Now we have to pay the prices. We have to think about that, how we can go to again to preserve our ecosystem. Otherwise, we'll be in trouble. Thank you. Thank you very much. Thank you very much for listening. Thank you for your attention. That's all for my presentation.
Thank you, Professor. So I guess we all listened. So if you so now the question and answer session begins. If you have any questions, please ask those in the chat box or via YouTube comments, and I will read it out and pass those out to the professor. Before I begin the session, let me just give you the code for the certificates. So just like before, every letter is small letters. So the code is A35T52. I repeat, A35T52. That's the code, and send this code via the link you're given, and you will get the certificates. So I guess the host will comment the code in the comment section so that it's easier for everyone to read. Okay, now the Q&A session. Yeah. So to Professor Rahab.
Yes.
In some Adis Garis asks, in some cases, bats transmit so many viruses. What makes bats the perfect host for so many viruses?
What makes the perfect so many viruses? In fact, we don't know what the viruses is carrying by the wildlife, because this wildlife they have a place and human beings another place. But now what happened when human beings come in contact, they have a close in contact, and they damage the forest, and this is the reasons. And this is the regions. This is the way the virus is transmitted from the animals, from animals to human beings. Now humans start to consume the wild animals. It was before. It was not that. And this is the reasons, because we don't know what is inside. We don't study. It's very difficult to study what animal virus which is a candy. We all the time study in human beings. It is assumed. It is in the nature. Nature has been told, okay, animals should live in the forest, and human beings. But what we do, because of our greediness, we human beings, we destroy the forest, and this is the reasons, and then the virus comes to the human society.
Okay, thank you, Professor, for that. Professor, thank you. I would have asked you to turn your camera on. So the next question is, somebody would like to ask about the new strain of H1N1, and has anyone tried to examine this from epidemiological point of view?
I don't know. To be honest, I don't know the answer. I told you how this RNA virus, this particular influenza virus, they are segmented virus, they have 8 segmented. So, and the RNA virus has a tendency, they have a lack of the proofreading, and besides they have also segmented virus. And these are the causes, these are the regions. There are so much mutations. And there are several hemagglutinin type and the neuroaminidase. Still some hemagglutinin yet to be discovered. When we are students, we found 11 to that one was low, but in every year this hemagglutinin and this and the neuroaminidase subtype is discovered, and new subtype is identified. So it is very difficult from how, and that means we have to do always the surveillance in the human beings and the animal population. Is there something wrong, and we have to check this virus strain from the human beings and the animals for the prediction of any pandemic. If we see there is high mutation and the gain the avian receptors, the gain the mammalian receptors, and then we can predict, okay, there may be some the pandemic.
Okay, so we have 9 minutes left for the question and answer session. So the next question is, somebody asks you that, do you think antimicrobial resistance is equally important like zoonosis?
Pardon, antimicrobial resistance?
Is antimicrobial resistance equally important to zoonosis?
Yes, antimicrobial is also, of course, because because we are using just if you look at the history, when Alexander Fleming he discovered the penicillin, he immediately also warned the people, please don't, this is a very good, but if you don't use rational, then we will be in trouble. This bullet will not come. And now we have found, and because this is a human food chain, and this virus is this antibiotics comes to the human beings, and because of intricate way, and that's why we have a problem. Of course we have to be very cautious. We have to think on that, and also some alternate. Sometimes the people now are trying to identify the bacteriophage. Bacteriophage is using a bacteriophage for destroying the bacteria. These are alternative way people are thinking now.
Okay, sir. The next question is, what is the similarity between COVID-19 and infectious bronchitis disease in poultry based on respiratory mechanism?
Yes. In fact, actually, I also initially I was also thinking on that but I didn't find any people do this research. But when I go to the figure, morphologically, I found all of the similars, because it is also the hemagglutinin steroids, and these in case of the poultry infectious bronchitis virus, it doesn't give the direct hemagglutination. It first is some enzymes are needed. When this hemagglutinin spike, then it comes up, then it causes hemagglutinin, and this is also same for the. But of course, maybe there may be some difference, but I don't know what is it. But there must be there are many similarity, because it is the same family, and it is also the same hemagglutinin virus. It is also found. Just one affect the human beings, and we have to actually if you do the sequencing, then we can identify, okay, what is the and what is the difference or what are the not. Then we can maybe identify this. But I don't know the answer actually, how much similarity and how much dissimilar. But of course, there will be some similarities.
Okay, sir. The next question is pretty simple. Somebody asked us, how does Ebola kill a human?
How Ebola does kill
a human?
It caused serious hemorrhage. Because of the hemorrhage, just people die, and this hemorrhaging, this bleeding comes out different natural openings, and it's so high damage. That means it infects it affects the blood vessels, and so there is a release of the blood, from all the natural elements, and because of the bleeding, the shock developed and the human being died. And it is also considered that the first case was because of the consumption of the bush animals. It was believed that.
Okay, sir. The next question is, what can be done from human as well as veterinarian fields to reduce and control the adaptation and mutation of RNA virus?
This is, now, yes, this is, I think maybe there's one session I found that it is One Health approach, and I showed you, this is the rabies virus. This is not the case of the only veterinarian can effect. Veterinarian can treat the animal, human treat the physician treat the human beings. But we have to consider. I want to mention one thing. Well, there's a very, I like this. One person, one veterinarian told, when Louis Pasteur discovered rabies vaccine virus, he vaccinated just human beings, but he doesn't consider the reservoir. And initially, if he give two vaccines, one is for the human beings, if he give another vaccine to the dog reservoir, and we didn't find, and in these days, we will not find this type of problem. We always concerned human beings. We always concerned with ourselves, but we don't concern of the reservoir. But now this is the time we have to think about that, and all the ecologists, the human beings, and the physicians, the veterinarians, because they have some. Now, and we can understand that this is not a single process. This is a complicated process, and we have to combine together, and we have to formulate a single policy so that everyone can contribute, and the one single disease has to be is manifested. And when everyone sit together and then get some formulation, then we can disease. Suppose like with rabies. Is a case in here, physicians and the veterinarians, the ecologists, the wildlife veterinarians, and the people of municipality and the mass media, when they all come together, then it can be controlled. Otherwise, it is not possible. No, it is not one man can do this. No.
Okay, sir. I think this is the last question. After that, I will summarize the session and end the session. So the last question is, what are the chances of other corona strain mutations infecting humans in the future?
It is very difficult to predict it. It is very difficult. But the lesson that what we have damaged, we should not damage again. We have to preserve our ecosystem. We have to preserve our forest. We should not go to the encroach to the wild animals. We have to think on these things. But you cannot predict what is. At least we should have a lesson. What damage has been done, we should not go for the further damage. Rather, we should restore what of the damage has been done. That should be the policy. And by this way, I think we can minimize the problem.
Okay, sir. I think this is it for us. I think our time is over. So before I end this session, I'd like to summarize the whole session in a very short way. So today we talked about the virus structure, definition of zoonosis. We started with small things like that for the introductions. Moving on to the zoonotic viral diseases shown in a tabular form, and some brief description of different zoonotic diseases which we recently have seen, like Chikungunya, Congo hemorrhagic virus, Ebola, Influenza, MERS, Nipah, Rabies, West Nile virus, Zika, and COVID-19. And we had some interesting questions about the antimicrobial resistance, future infection of humans or pandemic in humans via the other coronavirus and so on. So this is a very informative discussion, I think I can say, for everyone. So thank you all for joining us. And if you have any questions for Professor Ahad, please mention this in the chat box. I think I will be available for the next 15 minutes as well. So that I can pass those along to Sir, and he can answer this via email. So thank you all. I think I'll pass the session to the host to end the session. I would like to also mention that for those who didn't get the form for the certificates, I will send those right now once again. And make sure that you put in the code in the form to get your certificates. Okay, Professor, thank you very much. Thank you all.
Thank you very much. Thank you, Samantha. Thank you.
عليكم